Hi everyone, this is Prasanna from Medax OSCE Academy. Welcome to our another OSCE training video.
Today, we're mastering a high-stakes skill, the Venturi Oxygen Mask. This station tests your precision, safety awareness, and patient-centered care, not just technical steps. By the end, you'll tackle it with confidence. In the OSCE, you'll be assessed on equipment preparation, correct adapter selection, oxygen flow rate, accuracy, patient communication, monitoring, and documentation safety checks. Remember, examiners look at your clinical reasoning, not just if you can perform the steps. Let's break it down. Step 1. Preparation always start with the doctor's prescription, your clinical guide. Verbalize. Prescription is for 28% oxygen via Venturi mask. Confirm patient identity using 2 identifiers. Are you John Doe, born the 15th of January, 1990? Gather your equipment, mask, color-coded adapters, tubing, oxygen source, and pulse oximeter. Step 2. Adapter selection. Venturi adapters are color-coded. Memorize this chart. Blue equals 24%, white equals 28%, orange equals 31%, yellow equals 35%, red equals 40%, green equals 60%. Pick the adapter that matches the doctor's prescription and clip it firmly onto the mask. Connect the oxygen tubing securely to complete the setup. Choose the white adapter for 28% oxygen. Verbalize. White adapter selected for 28% oxygen. Attach it securely to the mask. Step 3. Flow rate. Set the exact flow rate as per the adapter instructions. No guessing. For the blue 24% adapter, the correct range is 2 to 3 L-min. Verbalize. Flow rate set at 4 L-min as per manufacturer S guidance for 24% Venturi mask. Accuracy is vital. Too high or too low can harm patients with COPD. Step 4. Mask application. Apply the mask gently and explain as you go. I'm placing this mask to help your breathing. Is it comfortable? Adjust the straps and nose clip. Comfort matters as much as function. Step 5. Monitoring. Check oxygen saturation before and after application. Baseline SpO2 is 92%. I'll continue to monitor and reassess regularly according to the patient's condition. If SpO2 drops significantly, for example, to 88%, escalate care immediately. This shows examiners you prioritize safety. Step 6. Air entrainment collar. Keep the side vents clear. Verbalize. These side vents must remain uncovered so oxygen mixes correctly with room air. If vents are blocked, the FiO2 delivered will be wrong, a common OSCE trap. Step 7. Documentation. Record everything clearly. Venturi mask 28% at 4 liters per minute applied. SpO2 improved to 96%. Patient is comfortable. If it's not documented, it's not done. Common mistakes to avoid. Wrong adapter color gives, learn the chart. Incorrect flow rate gives, always check adapter instructions. Covering vents gives, keep them clear. Skipping SpO2 checks gives, assess before and after. Poor communication gives, always explain to patients. Pro tips to pass practice the 3 checks. Right adapter gives, right flow gives, right documentation. Verbalize every step so examiners hear your reasoning. Work within the 12 to 15-minute time limit for clinical skills stations. Safety first. Every action must demonstrate patient protection. Conclusion, and that's it. The Venturi mask demystified. This isn't just an OSCE skill. It's real-life nursing practice. Keep rehearsing until it feels natural. If you found this helpful, subscribe for more OSCE guides. Need personalized training? Call us at 07865 235 335 or email info@medax-group.com. At Medax OSCE Academy, we turn stress into success. Thank you.